And if I didn't get in this cycle, I was like, I better have it for next cycle.
No way you're taking Gen Chem
I
again.
was taking Gen Chem again.
So I get dropped off at the Oglethorpe Mall.
No.
Then I decide.
Are you in your suit?
No, I was in shorts.
Thank
and
God.
I was in a polo.
Clinicals, although
having a lot of surgeries before even getting clinical experience.
Chris would come in and be like, are you doing okay? Like, can I explain anything and kind of help you make a decision?
What's a good provider and a poor provider?
I really prioritize self-care. And
yeah, it's been so important nowadays too.
Oh my God.
Welcome back to the STAT podcast, where we have conversations about the pre-PA life, PA school, and the PA you've always dreamt of. Today we have Paige Ruscher. She is my classmate from South University, Savannah. She completed her clinical rotations in emergency medicine and pediatrics. And now she is a guest of today's podcast. She obtained her undergraduate degree in integrative physiology from the University of Colorado Boulder. Her patient care experience was a total of 3.5 years as a medical assistant. Her first medical assistant job was in a vein and vascular clinic for about 2.5 years, and the next one was for about a year for 2 hand ortho surgeons. She has had experience in prepping sterile procedure trays, prepping patients for procedures, casting, splinting, and DME fitting. I hope you enjoyed this conversation with my fellow classmate, Paige Ruscher.
So today, what are we going to talk about? Your pre-PA life is pretty interesting.
Yeah.
And I and also other people will benefit from knowing about your pre-PA life.
I hope so.
Yeah.
So when I was interviewing for PA schools, I was a nerd, and I would tell them that my superpower, or like my advantage, is that I have a lot of experience being a patient. So I had 14 hip surgeries before school. I found out when I was a sophomore, as a little pre-PA, that I was born with something called hip dysplasia. And they also told me it was like one of the world's worst cases. They didn't know how I played soccer my whole life, let alone walked. So I essentially was born without hip sockets. So instead of having a cup, I was completely flat. And then my femurs were like backwards and vertical.
Okay.
So I walked like this instead of walking like this, which created a huge challenge if I wanted to be a provider, because being a provider is very active. So I went on to have 12 surgeries to reconstruct my pelvis, and they cut both my femurs in half. They turned them around inside the socket, and that was in the middle of undergrad. I had to take about like a 1.5 year medical leave in the middle of my undergrad degree. And then after that, I lived my life on crutches and a cane for about 4 years. I needed a cane to walk more than 100 yards, but I wasn't able to start my clinical hours until I was able to walk. So I took about 3.5 years gap year, which might scare people, but I love it.
First thing is that requires a lot of patience.
Yeah.
Because if I was in your position, I don't think I can develop all that patience, because it's tough. It's tough being a non-patient, like a person who hasn't had a lot of surgeries in their life, and having a condition that affects your feet not only impacts getting clinical experience. So how did you like manage all that, especially the having a lot of surgeries before even getting clinical experience?
Yeah. I won't lie, it was very hard.
Yeah.
I also have no idea how I did do it, but I tried to stay positive. I had a huge, massive support of family and friends. And when I was in the hospital, I had an incredible team of PAs, and it just made me want to be a PA that much more. They changed my life, and so I was persistent, and I just took it day by day, week by week. I was determined to walk. I I was determined to get my hours. I don't know.
What are some?
Yeah, I'm like,
like what are some things that? Okay, let's talk about your love for the PA profession. How did it all start?
So,
but it has to be so strong for you to continue this journey because it's a long one.
Yeah. So I found out about the PA profession through an ACT tutor in, I think, my senior year or junior year. I don't remember when you take that test. And my mom was a nurse, and I thought my mom was the superhero, greatest human being on this earth.
Nurses are great, yeah.
I would tell my mom, I would tell everyone, my mom saves lives every day. And so I looked up to my mom and I was like, I want to do something in the health professions like you. And my ACT tutor told me about the PA profession, and my mom worked with PAs, and she also kind of encouraged me to go there. She knows I'm a little strong-willed and like to be a little bit bossy, but not too bossy. So she thought PA would be a good route. And so I went to undergrad and I went on this pre-PA journey, and I really had no idea what I was doing. I was taking the same classes as like pre-med or other pre-PT, PA people. And it really wasn't until I had my first surgery that I was really exposed to what a PA meant. And then from there, it was like all I could ever dream of being.
A PA.
Being a PA.
Yeah. So when you talked about your first exposure to a PA, how did it look like to you, and what was that support system like?
So my PA's name was Christopher, or Chris, and I met him the day that I was diagnosed with hip dysplasia.
Okay.
And the visit was kind of just felt like there was a tornado going on in the room. It was just a lot to take in. I had the MRI that told me I was like severely deformed. And I was kind of past doctor to doctor. So I finally get to the surgeons after several doctors. And it was kind of like what we do on rotations. There was a student that came in and did a physical. And then I had a fellow come in and do a physical on me. And then he presented to the attending. And then the attending and the PA came in. The attending diagnosed me, and he literally said, I don't know how you walked your whole life. I've never seen anything like this. And he essentially said, we need to do 6 surgeries on you. And he said, like, periacetabular osteotomy, like femoral osteotomy. And I have no idea what these words mean to me. So they like leave the room, and the PA, Chris, stayed in the room. And I remember he just sat, he got down on my level, and he was like, how are you doing? Like, what questions do you have? He explained to me what periacetabular osteotomy meant. He's like, peri means around, and acetabulum is your hip socket, and osteotomy is to cut bone. So we're going to cut the bone around your hip socket and try to move it over to create a socket. And he got me in contact with Facebook support groups. We got his number with any questions, and he would be my PA and on my care team for about 3 years, and kind of be my right-hand man and my little cheerleader. We'd always talk about my pre-PA classes and my favorite ones, my least favorite ones at follow-ups. But yeah, he just was so empathetic and smart and kind, and if you were hurting or anxious, he was there and was immediately, making things happen. And you could tell that he was kind of the glue that made that whole team stick together, and he kind of ran the show secretly.
So why didn't you choose the MD route, and why did you stick with the PA route? Just because of Chris, or is it a lot of different factors, you think?
I think there's a lot of different factors. Like, frankly, a lot of it towards the end was time.
Yeah.
Because it wasn't like a year and a half in one chunk that I took out of undergrad. It was like my first took a year off and I had 8 surgeries, and then I would go back a semester, and then they'd be like, oh, you need to have this surgery, and I'd have to drop out of that semester. And then I would try to go back, and then I would need another surgery, and then eventually got to like 12. So I just at that point, I wasn't sure if I was going to finish undergrad. So time, PA is shorter than MD. Two, Chris, he just spent more time with me. I felt like he was the person that I always saw and I really like connected to as bonded. I felt like he explained things to me, educated me. I was able to make informed decisions as a young adult because he spent all that time with me. Whereas I kind of felt like my surgeon was like, we want to cut.
We want to do this.
We want to do this.
And we go.
And he was frank. He was very frank. He was like, you have bad hips. You're not going to walk if you don't do something about it. And then Chris would come in and be like, are you doing okay? Like, can I explain anything and kind of help you make a decision? Yeah. Chris was like who I saw all the time. He was the PA.
That's an awesome mentor, I guess, to have, because not a lot of people do have it. But I would say that talking to a lot of pre-PAs online or in person, when they talk about informed decision making, that's what they have learned in their pre-PA life.
Yes.
And I love that because I didn't learn that.
Yes.
Until I went to PA school.
Yes, it literally changed my life. Like some of those surgeries did kind of leave me in a worse position, which is why I eventually made the decision to replace my hips. But again, it was another PA that told me, get this surgery or this hip replacement. Here's pros and cons. And then they had a follow-up appointment to discuss my decision to make sure that was the one I wanted. And they gave me all of the evidence and everything. Because at the end of the day, the patient does have to make the decision for themselves. But being informed, I feel like I was an expert and I don't regret any of the decisions I made. I truly feel like the hip replacements have changed my life, and I can thank my healthcare providers for teaching me.
I'm so glad that you got the surgery. That's amazing to hear too. But how did all those surgeries impact your undergraduate experience and the grades?
Yeah, so funny. I actually did, because I was so much more motivated that I wanted to do it. I actually got better grades in the midst of having all of these surgeries. So I had to take a year off, so I completely put my degree on hold. I got a degree in integrative physiology. Science classes, as you know, are very impossible to take online, and PA schools don't like online classes. So I would take electives. I took Shakespeare online while I was having surgeries. But I think I did better. I was more motivated. I studied harder. I performed. I was so determined to do it afterwards. I'm sorry, I'm forgetting the rest of your question.
Oh, just how it affected your grades and your experience. But like you said,
the experience was definitely hard. The experience.
Any FOMOs?
So much FOMO, especially when I first had my surgeries. Seeing all of my friends go out, and then once I got a few surgeries, I was naughty. My parents were like, yeah, go ahead. My parents were so sad that I was going through all this that they were like, please, friends, come over. So my friends would come visit me. And then sometimes they would literally drive 30 minutes to Broomfield where I lived. And they would pick me up. We'd bring the car that could fit my wheelchair and my crutches. And then we would go to the bars in my wheelchair and crutches.
Things you got to do.
And I'd be dancing. Yeah. I'm famous for some cane dance moves. Definitely got a lot of people free drinks in my wheelchair. It was a little dangerous. Lots of crutches. A lot of people telling me I was faking it. That was actually people. I got a lot of faking it accusations. I was just so good at crutches after 4 years. They were like, there's no way you need them.
That's terrible, honestly.
It's so terrible. I'm sorry, I'm laughing. Terrible. It's so terrible.
But I mean, it's funny now because now
they're like, why are you in the bars? And I was like, I've been on these for 4 years.
Yeah.
I'm 21. I need to live it up. You want me to be sad in my bed? I refuse to be sad in my bed. I would have moments feeling sorry for myself, but I knew that would only just put me in a hole further.
That's interesting you say that because I feel like most people would just the opposite.
Yeah, and most people would tell me. I think it was almost motivation for me. Most people would like, be like, you're doing so well. If I had that, I would off myself. You know, they like, people were very out loud about how miserable they perceived my situation.
Mm-hmm.
And I didn't perceive it that way.
Yeah.
I didn't perceive it that way. If anything, it was like an answer to not being believed my whole life that I wasn't insane. And it was almost comforting that like that something was wrong and I could trust myself.
Yeah.
So, yeah. But yeah, I just hope to bring that heart to my patients.
So long gap years.
Yes. So I could not, because of my crutches, I could not work in, no clinic would take me, even for volunteering. They're like, you're on crutches, you're a hazard. Oh. And then, so I tried to work in like PT clinics.
A lot of barriers.
Yeah, so many barriers.
Yeah.
And so eventually, when I was strong enough on a cane, I would just keep it in my front seat for years. And I worked as an MA at a Vail and Vascular clinic for about 2.5 years. And I was lifting people's legs, but I wasn't walking far. I was also the front desk, but it was really cool. I got a lot of like surgical prep trays, and I was assisting in procedures with the PA. And then I had to get my hips replaced at that job. Okay. And I wasn't allowed to lift legs anymore. So I kind of had to pivot and find a different medical assisting job. So I went to orthopedics across the street, and I worked in hands where I wasn't lifting big body parts. Smart. Yeah. No, I like.
That is so smart. How did you get that job?
So it's so funny. So I actually, when I was hip surgeon shopping, I almost went with one of the surgeons at that place, but then I went to a different clinic. Okay. Just because the guy who did my hips invented the anterior hip replacement, not to brag. So I just felt like I couldn't pass that up. But I really liked the team over there, and it happened to be right across the street. And there was an opening, and it was hands. And I said, I can't lift legs anymore. So I went and worked in hands.
I'm glad you said that, because like,
again,
when I wanted to make clinical experience changes while being a pre-PA, it was tough.
It's hard.
But so how do you have an approach to like interviews and like like getting a clinical experience, getting some clinical experience before PA school?
You gotta sell yourself.
Oh,
that sounds weird.
No, literally it is.
Yeah, no, you have to sell yourself and personality, and also you're here for the patients. At the end of the day, we are going to school not for ourselves, but to help others, and here for the patients. And so I always kind of make that very evident in my interviewing, wherever I can put that in there. And when I applied to the hand job, I was only 4 months out from bilateral hip replacements. That's not an easy hire. Yeah. And I had to kind of be forthcoming with that information. So I sold myself hard. I was like, I'm a fast learner. Like, I'm excited. I'm a pre-PA. Like, I have an interest in orthopedics. Like, I think this would be just so exciting for me. People love someone who's enthusiastic. Yeah. People want people that want to work there or want to be in PA school, not just I'm smart and I know I could do it attitude. Nobody likes that. So don't do that. And that's my tip.
That was so funny for some reason.
Be enjoyable and they'll invite you.
Yeah. Did you use the same strategies for PA school interviews?
Yeah. I'm so annoyed.
It took me 10 interviews to figure that out.
Really? Yeah. No, harsh.
That was crazy. It took me like a long time to figure that out. That's why I didn't get in first cycle.
Yeah. PA school interviews are so hard because they're all so different. And like South's interview, it was my first interview that I ever did. And before I even got an interview, my worry was paper. Because I had so many gap years, I started having like prereqs that were expiring. So while I was getting patient care hours, I was having to retake like Gen Chem because it was about to expire. And if I didn't get in this cycle, I was like, I better have it for next cycle.
No way. You're taking Gen Chem again.
I was taking Gen Chem again.
Oh
miserable. My God. Miserable. So I was taking that while working.
So you actually did?
Yeah.
Recently?
Yeah, I retook Gen Chem.
What the hell?
Because I'm old. I'm about to be 29 in like 3 weeks.
Yeah, but still, taking Gen Chem again is death.
Yeah, it was death. So I had to like retake Gen Chem 1 and 2. 1 and 2.
You went through it.
I went through it.
You went through it.
Okay, sorry. Back to your question. No. Oh no. See, this is bad. I swear I don't have ADHD. What was your...
Same. I'm still trying to figure that out myself.
Everyone says I do, but I still don't think I do.
Well, we were talking about interviews and stuff, and how you took personality.
So our interview here at South, I had like read. Do you know that little? I think her name's Savannah.
Savannah Perry.
Yeah. So I read her book. I
love that book.
I love that book. Yeah. People need to read that book.
Every PPA who has interviews need to read that book.
I used everything in that book to get into PA school. Yeah. I read it on the plane. I filled out the little answers. I studied it.
Yeah.
So I
used the Bible of interviews for PA school.
It truly is. And I found it through like stuff like this, like podcasts.
Okay.
I will say podcasts and Instagram posts also helped me get into PA school for free.
Oh yeah.
Like that is how I learned how to get into PA school with content like yours. So thank you.
Not me, Savannah Perry.
Yeah, Savannah Perry.
She actually follows me on TikTok, and I love it. I love it.
We love you. Thanks for
we love
my
you.
Future career. I'll send you a $10 check. I'm poor. I'm poor. No, okay. Yeah. So our interview, they gave us 5 scenarios, right? And it was like weird scenarios, and they're like, "What would you do?" And it's clinical scenarios. And then I quickly realized there's nowhere for me to insert my personality and my why. And Savannah Perry, I feel like, really said, like, make sure you like are genuine and give a little personality, because it sets you apart. Because everybody's going to be answering the clinical question.
Yeah. How
do you set yourself apart? Also, I feel like PAs are like known to being like more personable, and patients are able to relate, which I think benefits people's care. Yeah. So I was like, how do I fit in my story and like what sets me apart? Because my grades in undergrad, I was so average. Like I was like not competitive. I like really had to sell myself, and it worked. I got in first try.
Yeah.
So
first interview,
first school. Yeah, I only interviewed at 2 schools. I got other interviews, but South started early.
First interview.
1 week later got in, and the other school I also got in.
Wow.
I think it's my personality.
Okay,
I think it's my personality.
Yeah.
Just kidding. I did a lot of hard work, but I really everyone else does a lot of hard work, but I think it was my personality.
Yeah,
I tried to.
That interview day is just 50%. Like if they like you, you win. And if you don't, it's
and simple. That was my mentality. I told people, I was like, if I can convince them to invite me to their home with my piece of paper, I'm in. I can win them over.
Yeah.
And I lied to myself, and I believed it, and we're here. So fake it till you make it, and you'll make it.
Yeah. Let's talk about how your experiences as a non-traditional pre-PA affects being in PA school, especially didactic here.
Yeah.
Because I saw your little nice big chair in didactic in class. It was so comfy while we were.
Sorry, you guys were all going numb in both legs.
Numb in both legs. Pain shooting down the leg.
Meanwhile, I'm like this.
Yeah, low back strain every day.
Yeah. I was thinking about that on my drive here, and I was thinking, if all of my classmates could have my chair, I think everyone would succeed.
Everyone would.
No, I truly think I felt so bad. I was not seeking attention, I swear.
Do you have a picture of you sitting in that chair from didactic?
I think I do, and I will try to send you. My mom took a hilarious photo before the white coat ceremony, because we walked into the room to show her where it was, and I was like, guess what chair's mine? It's just like a huge box in the center of the room.
I have to put it up on the video.
Yeah. Well, I'll send the chair. But my experiences, it just makes me study really hard. Like I know how, like a pediatrician didn't find my hip dysplasia,
right? Not
just once, but multiple times. It was never found on physical exam.
It was missed all throughout your childhood.
All throughout my childhood. I didn't find out till I was 21.
Yeah.
I would mention hip pain to like my primary care doctor. She always offered to like get an x-ray But like nobody kind of believed me. So I wasn't sure, like when I played soccer for 10 years, I wasn't sure if I was like being lazy, if I was making it up. Because it was just like a deep, dull ache. And then I would struggle walking. I would get tired fast. It would feel like my leg couldn't move after pretty soon.
Why do you think that pediatrician missed it? Is it because of just being unique and like saying, hey, I think my clinical reasoning is unique and I'm going to do things a different way with you as a patient? Or if it's just negligence, or if it's just...
talk to
ignorance.
Any provider that I have shared my story to, and they're like, negligence. Having gone through my peds rotation and doing, is it Orlani and Barlow's?
Yeah.
I was doing it and I was like, please don't do any babies injustice. It's kind of hard, Yeah. I don't know why it was missed. I don't want to say that it's complete negligence. But I always give all my providers the benefit of the doubt because I know everyone's human.
Okay. Yeah.
So I don't know how to answer that one.
Okay.
Sorry.
It's fine.
But it was missed, and unfortunately it led to a pretty severe physical disability that will affect every decision that I ever make for the rest of my life. Yeah.
Yeah. So how did it impact like clinical year?
Sorry, yes, back to your question. Yeah, clinical year. I have never studied this much in my entire life.
Because it's serious now at this point.
And it's serious and it's personal.
Yeah, it's personal. Yeah.
I think that is really when I'm exhausted and tired and just feeling like a brat and not wanting to do it because PA feels exhausting. I remember that there's real people on the other side, and I was one of those real people, and it just makes me study for the real deal, for people's lives, and I don't ever want to hurt anyone's health or be that PA that misses hip dysplasia.
Yeah.
And then also like physical exam, it kind of reinforces how important technique is and remembering to do those special exams that we don't always remember to do. It's and then I really prioritize self-care and
it's been so important nowadays too.
Oh my god, we have no time to do it.
Yeah,
but I 30 minutes a day is all you need.
What do you do?
I have a little workout app that I'm obsessed with. It's Form.
It's called Form?
Form.
Okay.
Yeah. It might be more girls based, but it's lifting weights. But I think anyone can use it. But it's just 30 minutes of movement, and it's like dumbbells and weights.
Okay.
And then I walk when I can. Finding sidewalks here in Savannah has been hard.
Yeah, so funny story. Really funny story. The South University was one of my last interview of the cycle.
Yeah.
I had to make it here.
Yeah.
I didn't know there were no sidewalks here. So I get dropped off at the Oglethorpe Mall.
No.
Then I decide...
Are you in your suit?
No, I was in shorts.
Thank God.
I was in a polo, black polo. This was the first day of the interview.
Oh no.
I should have worn much better things. Anyways, they dropped me off. It was me and my girlfriend. So we get dropped off at the mall. Now we decide, okay, now we're gonna just walk. It's like only a mile away, right?
Yeah.
We expected sidewalks.
You're on that grass.
Yeah, there were no sidewalks.
There's probably alligators in that grass.
Oh, okay. At least I wasn't attacked.
Yeah,
that was a good
thank
day.
God.
We were walking. I'm getting sweaty and stuff. I didn't expect the heat.
No.
I didn't expect there was no sidewalks. We get there, front door. I don't want to say her name.
Yeah.
But it was funny. So the lady who was standing, I'll tell you after that.
Yeah.
So she goes like something along the lines with, "You should have dressed better for this."
I already know who it is. I think.
Right. This is what I want to hear right now.
You're like, I feel so welcome. I can't wait to beg to be in this program.
Yeah. So I go in, and everyone is dressed professionally. I'm just like the
they told us casual
for
the first day.
Oh yeah.
Right?
I think so. I mean, in my email there was no
instructions.
but maybe should have the knowledge. But I
Was
don't
this
know.
the Thursday?
It was the Thursday before the main interview.
Yeah, the Thursday they told us to dress casually.
Casual,
they said
exactly.
Be comfortable, dress casual.
So I was comfortable. I wore my little shorts.
I wore a
and
sundress.
Polo.
Yeah.
Okay.
Yeah.
All right.
I'm pretty sure other people wore suits in my place too. Don't worry.
Oh yeah. The males who were in the interview session, they were all dressed up nice.
I hate
and I was the only. So that was my story
And
with
you were
no
sweaty?
sidewalks.
No.
So
No, I come from the land of sidewalks compared to here.
okay.
I love
Colorado.
walking. Yeah, walking's the only thing I can really do with my hips. But can you run? I'm like, never again. Can you bike? My hip squeaks when I do it. So walking's my one thing I can do, and I can't walk here. So I got a treadmill to study and do Anki on.
Anki, yeah, best combo.
I haven't done Anki in all.
I haven't done Anki.
I don't know if I miss it or not. I kind of do.
I don't miss it at all. So you used Anki during didactic?
Yeah, I was an Anki girl up until 5th quarter, and then 5th quarter was it just felt like so much for me.
Yeah.
That I literally had to just go to changing the PowerPoints. I would copy the PowerPoints and put them into a Word doc. That was 11 pages instead of 120 slides, even though it was the same exact thing, and it made it feel more doable for me. And then with my iPad, I would just block it out, and I would quiz myself by blocking it out. So
okay. Yeah, works.
Yeah.
Any active things, any engaging things always work.
So when I'm doing Anki or I'm reading my notes and I'm blocking things out, I'm actively teaching myself the physiology, and while it's blocked, I'm this happens, and then I'm actively almost talking in my head and annotating all my notes. Otherwise, not really. I'm active with my notes. I don't know how to explain it. You don't want to see my notes. I look a little crazy.
I mean, it depends on what goes in your head. That's what matters.
Right? I passed my exam, so
yeah.
We've made it this far.
We made it this far. We're so close to graduation.
We're so close.
We're so there.
We're so close.
Finish off.
Yes.
I will have some. What's it called?
No questions. Don't do this to me.
No, the questions I always ask in the end. But before what's a good provider and a poor provider? We already talked about negligence. Could be negligence. Could be poor physical exam skills.
Yeah.
What are other things in your opinion? Being a patient for so long as
one, listening.
Oh yeah.
Yeah. I went to the primary care recently, and they put the stethoscope on my heart, and they're like, "Yeah, she's young, blah blah blah. You don't need anything." That was her only physical exam, and then everything's wrong in my chart. I was like, nobody listened to me. So listening. I think your body language as well, sitting, getting eye level with the patient, making eye contact, kind of nodding, repeating what they're doing or saying to you, and just reassuring, I hear that this is going on, or this is your concern. I will, if it's within my limits as a provider, I'm going to do what I can. We'll explore this. This is also what I'm thinking. I think just sitting down and making them aware of why you're doing things and that you hear them makes people feel so much more comfortable. And if you have a comfortable patient, they're going to be more honest with you, and that leads to better care. When they don't feel safe or comfortable with you, they're not going to tell you important things. So don't be judgmental. Just always be safe space, and listen. I've had so many patients, and it makes me want to tear up. And I had a patient this week who says she comes to the ER all the time because she lives alone, and she's like, "You guys are the nicest people that I've encountered in a few years, and you guys always treat me very nicely here." And so I think kindness and listening to people goes so much more than we realize.
I totally agree.
Yeah.
With everything you said. So right now I have a great clinical site, which I told you before.
Can't wait.
Because we are allowed to see patients from day one. One of the things I really want to work on, like you said, is communication skills.
Yeah.
Because we're taught to just check boxes.
Yeah.
Chest pain, shortness of breath, you have fever, chills.
Yep.
but actually like sitting down and nodding, smiling
Yeah. While your wheels are also turning.
while your wheels are also those are some skills that you need. This is the time to develop it.
Yeah.
Like you will develop it after you become a PAC, but as a PAS, you need to, I guess, put some effort in doing that.
Yeah.
So whenever you have a good clinical rotation site, you just start working hard.
Yeah, working
in
hard.
That.
And seeing as many patients as you can.
Yeah, and listening to lungs as much as I can.
I hated listening to lungs in pediatrics. I'd be like, I hear wheezing. She's like, clear. And then I'd be like, these are clear. And she'd be like, wheezy.
50-50 shot all the time. Yeah.
But adults, I will say, in the ER, the really sick patients, I nail it every time. But that's because they're very bad. They're very bad lungs.
Okay. Rapid fire questions.
Oh, God. Okay.
All right. It's in my mind.
Okay.
They're not here.
Okay.
So, okay. What rotation, if you had to do it again, would you do it in? ER or peds?
ER, hands down.
But you liked your peds rotation.
I liked my peds rotation. My peds rotation, I loved my preceptor. It was really difficult because there was a big language barrier. So not only was I learning, and pediatric medicine is way different than kind of most of what we learn, everything, but you know how it's a very special population.
Yeah.
None of my patients spoke English. So I was learning a language.
Peds?
None of my patients spoke English.
In peds?
Yeah.
Where did you do your peds? In Mexico?
No.
Oh.
No. No, they all spoke Spanish. I also had like some Creole, like Haitian patients, which is apparently a big population I did not know of.
Wow. Interesting. Yeah.
Yeah. But so I was on a translator a lot. I actually learned how to understand Spanish. I didn't learn how to speak it while I was there. But I think that made my peds hard. Also, having a patient that can't communicate is sometimes difficult. But sorry, peds. But I loved ER.
The hustling and the stress.
Pediatricians, or not pediatricians. I meant to say things to do with procedures. That's what I meant, not pediatricians. Yeah, I did a lot of suturing. It was so fun. And just wild. I kind of like it crazy.
Yeah.
I kind of like someone who's a little, like, mean. And I'm like, hey.
Okay. If you were a MA again, would you work in the vein and vascular or hand and wrist? Ortho.
That's hard. They both had their. The team that I worked with at Vail Vascular, I would choose the team. I loved both teams, but I would choose the team there because they were like my older sisters. It was just two girls, and it was so fun. We would like do workouts, and then skill-wise, I would choose hands. I was casting, and it was so fun and so many different things, and like a lot of learning. And the people over there were also awesome too. But we were too busy to do workouts in the hallway on our lunch.
Okay.
Sorry, didn't answer it.
Oh yeah, that's fine. If it's a neutral, it's a neutral one. But I asked this to every PA student I've asked so far: didactic or clinicals?
Clinicals, although
well, I saw something the other day on the internet where
I don't love both. I'll be honest.
Yeah, when you look back at your journey or memories, experiences, you only think of the good memories. Yeah, and so that's why you miss. Sometimes I miss didactic.
I miss the schedule of didactic.
Yeah, exactly. Yeah.
The certainty and consistency. Yeah. I knew when my exams were. I knew where I needed to be every day. Yeah. I knew I was going to have my comfortable seat for 8 hours a day. I knew when my meals were. Yeah. I knew where my food was coming from. Now, and do you know what material you're being tested on in didactic? Okay, but clinicals. Yeah. It's kind of fun. It's Wild West. You're getting thrown in there. It's
wild, yeah.
Yeah, and you're really testing what you know.
You're in the grind. Yeah. Every day.
But it's very humbling.
Yeah, it's very humbling every day.
A little doo-doo-dumb some days. Yeah.
No, totally. Like sometimes I just text in a friend's group chat saying I'm like I'm so like it feels dumb. Or I tell it to people around me. I'm like I feel like I'm so dumb.
Yeah, imposter syndrome is real right now in internal medicine and inpatient. Like I'm like I can treat the one person's patient problem, but I can treat all 5 things separate, but all together, you're getting in the weeds there for me.
Yeah. Last 2.
Yeah.
Best coffee shop in Savannah.
Oh, okay. I love. Where do I go?
Yeah. Do you go?
I do. I love a
Okay.
coffee shop. I do love Origin.
There's a lot. Oh yeah,
I do love Origin. I want a real good sweet treat, and I'll get a waffle at Mirabelle's. But
yeah, Mirabelle.
Yeah. That one you can't really study there, but I do love Origin.
Squeezed up.
Yeah.
But yeah, Origin is one of
squeezed.
my top ones.
Yeah. They also just dropped a new gluten-free menu. Not that I'm gluten-free.
For Origin?
Yeah, it looked good. Their food's just good.
The food is really good.
They have a lot of seats, and their coffees are really good.
Yeah.
Yeah.
Lastly, best restaurant in Savannah.
Oh, St. Bibiana.
You said that, and I think Peyton said that. So I will have to go.
Do you like Italian?
I love Italian food.
Can you eat bread?
I can eat anything.
Okay. I just didn't, if
I
you're
have
gluten-free,
no
I would
restrictions.
feel I love this. So there's first, the vibes are incredible, but a bread person comes by and they're wearing a giant thing of focaccia, and there's different flavored focaccias.
Let's go.
And then they bring you oil and balsamic to dip it in, but it's literally a giant bread guy. And it's like shareables, Italian, and everything I've had so far is so good. And the vibes are good. It's in Hotel Bardo.
Okay, noted.
Yeah.
Noted. All right. Thanks for watching, everyone.
Thanks for having me.
Yeah, this was fun. I learned so much in-person podcasts. Yeah. I did one online with a GIPA and other. I think I have some other PAs lined up, but they're all virtual. Yeah. But the thing I miss is being in person and just being present. Yeah. Yes. But yeah, so I hope you like this. I hope you liked our guest today.
Thanks for having me.
Thanks for watching, everyone. Bye.
Bye.